Hello everyone, I'm Vanessa, a certified yoga teacher as well as a wellness and purpose coach, and today I will be your host. This video today is brought to you by Guardian Malaysia, dedicated to helping you live your healthiest life. Have you ever wondered, how do I nurture my well-being? Well, you're not alone because Guardian is here to support you on your journey to better health. And today we have a very special guest with us who is coming to join us. And I would like you guys to meet, next to me, Dr. Kenny.
Hello.
Okay, let me tell you a little bit about Dr. Kenny, okay? So he is a highly accomplished cardiothoracic surgeon with an impressive list of qualifications. He holds a Bachelor's of Medicine and Master's of Surgery from the University of Malaya. He's a member of the Royal College of Surgeons in Edinburgh and a Fellow of the Royal College of Surgeons in Cardiothoracic Surgery. He's also certified by the European Board of Cardiothoracic Surgery in both adult cardiac and congenital specialties. In this episode, we're going to be talking about what heart health means, myth about heart diseases, we're going to debunk it together, why heart diseases is affecting more than young people, and how to take care of your heart better. Dr. Kenny, recently there have been cases of young people collapsing during sports activities. Moreover, they seem to be really fit and healthy youngsters. Why do you think this is happening so much more these days, or that we're seeing it more?
This phenomenon is known as a sudden cardiac arrest. It has been an entity that has been around for forever. In fact, it's just that nowadays you see it more often because of television. The activities are being captured live, and the pickup rates are greater than before. As the description implies, it's a sudden cardiac arrest. Is self-explanatory, in which the heart has failed and stopped abruptly,
Right.
leading to an arrest due to low blood pressure. And when the heart is not functioning properly, it compromises the blood supply to the brain and other vital organs, leading to the complete shutdown. And that's why they collapse and get arrested.
Right. Is the sudden cardiac arrest, is it the same as heart attack?
I wouldn't say it's the same. When you mention about heart attack, it's a very specific cause of a sudden cardiac arrest.
Okay.
Sudden cardiac arrest can be due to a host of causative factors, or what we call it the etiology. And it can be due to blockage to the heart arteries or the blood vessels, leading to arrest. It can be due to structural defect of the heart, for example, valvular heart disease. It can be due to conduction abnormalities, in which the heart is not beating regularly or normally as it should. So it leads to arrhythmia in these sort of cases, and the heart can just fail. So when you mention about heart attack, it's a very specific kind of sudden cardiac arrest cause, in which it is usually describing this blockage of the heart vessels,
Right.
leading to inadequate supply of blood and nutrients to the heart.
With the sudden cardiac arrest, you don't really have a symptom to it. But with a heart attack, does it usually come with a little bit more symptoms?
Yes, when you mention heart attack to the general public, it means you have a severe chest pain, difficulty of breathing. These are the two main complaints, but some of them, they can have tiredness, lethargy over days and things like that. Usually you have a preceding symptom in a heart attack,
Right.
leading up to the situation, and then you end up in the hospital.
Right.
But when you talk about sudden cardiac arrest, as you mentioned just now, you see a lot of sportsmen collapsing on court, footballers collapsing on field,
Yeah.
and things like that. It can just happen instantaneously without any premonitory signs, because they might be walking around with cardiac problems unknowingly, and they are being healthy and well up to that instance. That is why it's called sudden.
This is a game called the myth or fact. So you actually have two cardboards next to you. Whenever you're ready, after I have my questions asked, you can just show us, okay? So the first question is, only men get heart disease. That's a myth. Okay, interesting.
Because men and women are equal.
Wow, I like this doctor a lot. Okay, second question. Okay, stress can contribute to heart disease.
Yeah, sure thing. Stress can cause difficulty in sleeping. And then inadequate rest can cause a lot of anxiety and hypertension and etc.
Okay, next question. Heart disease always causes chest pain. What is this one? Oh, it's myth.
You can have a completely normal person not knowing that they have heart disease and they have no symptoms.
Okay, I have one more question. A high blood pressure can increase the risk of heart disease.
Yes,
Okay,
true.
it's a fact.
It's a fact.
Okay, we'll get a little bit more into that later. But I have one final question for you. Heart disease only affects older people. Myth. Okay.
Even children can have heart disease.
Oh, wow. Okay. You mentioned that these days there are more young people coming into your clinics. Do you mind sharing a little bit more about that?
Nowadays, it goes without saying, of course, you expect a lot of younger patients have coronary artery disease, meaning to have blockages in the heart vessels. My youngest bypass patient is actually 36 years old in my experience. It's not surprising in this day and age, partly due to the epidemic of young diabetes, young hypertension, young smokers, and young high cholesterol patients in this day of age. So all these things, this epidemic of all these diseases are recipe for coronary artery disease presenting early in the young age.
So when you meet them, you can't really pinpoint which one, but most of the time it's a combination.
Yeah, it's a combination. Most of the time, combination of these risk factors that they have.
Very often affected by lifestyle, would you say?
Sure. Sedentary lifestyles, when they smoke a lot, hardly exercise, they become couch potatoes. These are the risk factors of developing cardiac diseases. Young diabetes as well.
Young diabetes.
Diabetes, hypertension, hypercholesterol, and smoking. These are the bad recipes for developing cardiac diseases. And not forgetting obesity, epidemic of worldwide obesity as well.
Right. What are 3 effective changes people can make to their lifestyle?
Well, it's been a cliche, but you can't over-mention this, but really it's really important to prevent rather than cure.
Right.
So to prevent, you have to identify what are the risk factors of developing heart diseases. As I've alluded just now, diabetes, hypertension, smoking, high cholesterol, sedentary lifestyle. So you try to make changes to all these risk factors, and one of which is, like you mentioned just now, lifestyle.
Right.
How are you going to change your lifestyle to reduce heart disease? Simple things that we can do, such as reserving 30 minutes every day to carry out cardio exercises.
What would that look like?
Can be running, jogging, badminton, or whatever. As long as you sweat for 30 minutes every day.
To really bring up the heart rate?
Yes.
Okay.
And then, of course, you got to avoid smoking, reduce smoking or avoid altogether, adequate rest. And of course, you need to, if you have risk factors like I mentioned just now, diabetes, hypertension, you need to get them under control. So that will eventually reduce the risk of getting heart disease earlier.
How about food, Dr. Kenny?
Well, that's a big topic altogether. Food is important, and the key word here is about moderation. Teh tarik, nasi lemak, durian, and etc.
Yeah,
these sort of things are the main, so-called always made being the culprit of diabetes and high sodium loads to the body and etc. But personally, I wouldn't advise totally abstaining from all these delicacies. The keyword is still moderation. Okay, combine that with a healthy lifestyle and adequate exercise. I think that should do the trick. I don't think I can live a day without taking nasi lemak and teh tarik.
Doctor loves his nasi lemak lah.
But you need to try not to exceed your caloric allowances each day, and try to keep it moderate. That's the way to go.
So Dr. Kenny, what about vitamins and supplements? What's your advice on that?
The keyword to this is still moderation, just like the Malaysian food. While some vitamins and supplements are proven to be beneficial, and there's a lot of other supplements of which the benefits are not. So there's no harm in taking some supplements and vitamins. I'm not an expert in vitamins, so you need to consult the local pharmacies or the wellness doctors that are into this thing.
Is there any basic vitamins that you think everyday people should have?
Well, I think multivitamin is probably the best combination of all vitamins in one pill.
Right.
It's easy to take rather than take separately
Right.
different vitamin pills.
During COVID, right, vitamin C was like a big thing, right? Everyone was like, up your vitamin C. And, speaking of vitamins, at that time as well, we were all asked to get our vaccines done, Later on, there was a lot of news, I guess, saying that the COVID vaccine had effects on heart diseases. Like, is that true? What's the take on that?
The jury is still out there, actually. I mean, there's no direct, strong evidence of all these researchers saying that COVID vaccine or vitamin C affects the outcome of a COVID infection. There have been a lot of incidences of increased blood clots, which is easily attributable to the COVID vaccine. But it's very difficult to prove because there are so many other confounding factors. For all you know, these patients have already been having underlying cardiac diseases or some clotting disorders. It just so happens that they concurrently had a COVID vaccine during that time of falling ill. So it's very difficult to pinpoint. But there have been some studies and research that says that clotting phenomena is slightly increased in the COVID vaccination, but the direct linkage to patients having catastrophic clotting scenarios is very difficult to prove, I would say.
Right. So there's no concrete evidence just yet.
Yes.
But you did say that sometimes it has already come before, like in certain health issues that they already had, but they didn't know.
But they are not aware at that time.
How would you say is a good way for us to really monitor our health?
Always seek medical or a local pharmacy professional advice and health screening. Check with your doctor, do a health screening annually.
Right.
And then to pick up problems, before they manifest itself. And that's the best way to preventing diseases from getting out of control.
So you were saying like go check up and all that kind of stuff. But what about for people who are scared to go to the hospital, or they're like, oh, I have no time at all to, get this stuff that I need to do. They know it's essential, but they're too afraid or they don't have time to do it.
I understand what you're feeling. Some people have this fear of going to the hospital and being afraid of the white coat, seeing the doctors in white coats. For these people, probably they can have explored the option of going to the local pharmacies, such as Guardian, to get their health screening done, get some test kits, which can be done at home as well.
That's awesome. So hear that, guys. Like if you're too afraid to go to the hospital, head on to Guardian, just get yourself checked. I think prevention, as we've heard today, is so much better than cure, and it really does us a huge favor. Really, before we wrap today, Doctor, do you have any words of wisdom for all our viewers who are watching here today?
Message is still take care of your own health, eat well, and live strong. I can't overemphasize how important it is to exercise, rest well, periodic health check, and screening done, to prevent the complications of all the diseases that I mentioned just now, such as diabetes, hypertension. It's always better, less hassle and way more convenient to control these risk factors rather than treating the disease, when it comes to complication.
Okay, guys, I think we heard it from Dr. Kenny. The heart disease does not discriminate. It doesn't matter how old you are or what gender you are, it does not. So keep yourself in check. Head to a hospital. If you're too afraid to head to a hospital, there's Guardian, for example, for you to drop by. And until next time, I'll catch you in the next one. Bye, guys.